This is my cat Jake, and today we're going to be doing a neurological exam. So we're going to be starting off with some general observations. So we can see that Jake's mentation, he's bright, alert, and responsive. Any deviations in the level of consciousness could indicate either a forebrain or a brainstem lesion. Next, we're going to look at his posture. Um, so he has a normal relaxed stance, no head tilt we can see, which would indicate a vestibular lesion. Also no tremors, which would be a lesion of the cerebellum. If we get him to walk a little bit, I don't know if he will. Come on, Jake. Jake, I'll get a treat. Jake. As we see, he's walking. He has a normal pattern of movement. Come on, Jake. So he's ambulatory on all four limbs with no paresis or paralysis. No dysmetria, which could indicate a cerebellar lesion. Next, we're going to look at his muscle tone. So starting at the face, we're going to look for symmetry. I'm going to look for tone, especially of the muscles of mastication, any atrophy or changes could indicate a trigeminal nerve lesion. Also, the tone of his forelimbs and hind limbs, there is no flaccidness of the muscles, which would be a lower motor neuron sign, and there's also no excessive rigidity, which would be an upper motor neuron sign. Right, now we're going to move to the cranial nerve, so you can come closer to the face here. So looking at his eyes, we're looking for miosis, ptosis, or third eyelid protrusion. He doesn't have any of those signs, which indicates normal sympathetic innervation to his eye. Also, looking at his pupils, both are normal and equal in size. Next, we're going to do the menace response, which tests both the optic nerve and facial nerve. So I'm going to cover one eye here. And he has a normal response, which is closing his eye. I don't know if you'll let me do this one too. So that's normal. Next, we're going to do a palpebral, which is testing the facial and trigeminal nerve. So if I just tap the corner of his eye, he blinks. We're also going to look for strabismus, which is any deviations in eye position, which he doesn't have, and also nystagmus. We can also check for any nystagmus as we move his head. Jake. Next, we're going to go on to the pupillary light responses. So first, we're going to check direct response. So this is checking. He's not opening his eye, but as you shine the light in each eye, his pupil should constrict. And to check the consensual response, the light shone in this eye should also constrict. To test facial nerve, we are going to check the sensation. So I'm just going to do that by tickling the inside of his ear. He's responding by twitching his ear, which means his facial nerve is functioning. Next, we can check jaw tone and resistance. So that's normal. A drop jaw could indicate a bilateral trigeminal nerve lesion. Also, to test the glossopharyngeal, vagus, and hypoglossal nerves, I'm going to feed him a treat. So no problems chewing or swallowing. Um, any lesions could present as dysphagia or loss of gag reflex. Also, if there was a hypoglossal nerve injury, he could also have tongue atrophy, or it may deviate to one side of the mouth, which we don't see. That's done. Did you stop it?